Hey everyone, welcome back to the channel. Today we're diving into a topic that a lot of men experience but don't always talk about: sexual dysfunction. If you or someone you know has faced this issue, don't worry, you're not alone. In fact, studies show that over 50% of men between the ages of 40 and 70 experience some form of sexual dysfunction. So, what are the top 5 reasons behind this? Stick around, because we will be breaking it all down with science-backed facts and expert insights. Let's get into it. First up, age. Like it or not, time catches up with all of us. Research suggests that testosterone levels begin to decline by about 1% per year after the age of 30. By the time a man reaches his 50s and 60s, this decline can result in reduced libido and difficulty achieving or maintaining an erection. And it's not just testosterone. Blood vessels lose their elasticity, and the nervous system may not respond as quickly, making it harder to get things going in the bedroom. But hey, aging is natural, and there are ways to manage it, which we will touch on later. Number 2, psychological factors. Your mind plays a huge role in sexual performance. If you're constantly stressed, anxious, or battling depression, your body goes into fight or flight mode. This means your body prioritizes survival over pleasure, flooding your system with adrenaline and cortisol, which actively suppress sexual arousal. According to studies, as many as 20% of cases of erectile dysfunction, ED, are rooted in psychological causes. And here's the kicker: performance anxiety itself can make things even worse. The more you worry, the harder it becomes to perform. It's a vicious cycle. Now let's talk about number 3, your heart health. Did you know that sexual function is often an early warning sign of heart disease? That's because erections rely on good blood flow, and if your arteries are blocked or your blood pressure is off, it can directly impact your ability to perform. Studies show that men with heart disease are twice as likely to experience erectile dysfunction. High cholesterol, high blood pressure, and heart conditions reduce blood flow to the male organ, making erections more difficult. To make things worse, many medications prescribed for these conditions can also affect erectile function. So, taking care of your heart isn't just good for your health, it's good for your sexual function too. Coming in at number 4, diabetes. If you have diabetes, especially type 2 diabetes, you may already know that it affects your nerves. But did you know it can also impact your ability to have an erection? Here's why. Diabetes can cause neuropathy or nerve damage, which prevents the nerves in the male organ from firing properly. In addition, it affects nitric oxide production, which is essential for relaxing blood vessels and allowing blood flow to create an erection. Research shows that men with diabetes are 3 times more likely to suffer from erectile dysfunction than those without. And once again, medications for diabetes can also worsen the problem. It's a double-edged sword. And finally, number 5, prostate health. The prostate gland plays a crucial role in male reproductive health, but as men age, it can become a problem. An enlarged prostate, BPH, prostate cancer, or treatments like surgery and radiation can all cause nerve damage and disrupt sexual function. One study found that over 60% of men who undergo prostate surgery experience some level of erectile dysfunction post-surgery. Even medications for an enlarged prostate can have side effects that impact performance. So, now that you know the top 5 causes of sexual dysfunction, what can you do about it? Here are some quick tips. Exercise regularly. Studies show that men who exercise have a 30% lower risk of erectile dysfunction. Eat heart-healthy foods. A Mediterranean diet has been linked to improved sexual function. Reduce stress. Practice mindfulness, meditation, or therapy if needed. Get regular checkups. Address medical conditions early. Talk to a doctor. There are effective treatments available. And remember, you're not alone. Sexual dysfunction is common and help is available. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you don't miss out on more health and wellness content. See you next time.